Hello, my name is Joshua Austin. I'm a restorative dentist in San Antonio, Texas, and today I would like to share with you the true value of digital dentistry, a 4-step revolution for your practice. Does anyone recognize this? I mean, all of you do. All of you have one of these, an iPhone or a smartphone. Half of you are probably on it right now. I hope if you're watching something good video, good TikTok, something like that, drop it in the comments so we can all get a good laugh and see. Everyone has one of these. Everyone lives their life on one of these. And when I think to 2007 and I got the first iPhone, I thought I was buying a phone, and I guess technically I was, but I think in 2022, 2023, we realized what this device really is. It's the digital hub of our lives. It's our connection to friends and loved ones and pimple popping videos. iPhone is great technology. And the thing that makes great technology great is that it makes so many things you do faster, easier, and better. It's the hallmark of great technology, and those are the goals that we all have for our dental practices and our workflows within that dental practice. So what's our iPhone in dentistry? What's the thing that will help us see more and do it better? When most dentists ask me about digital scanners, they call them digital impression machines. And that's fine. Digital scanners are great at taking digital impressions and eliminating the goo out of it. But if you get a digital impression scanner and use it just for that, well, it's sort of like buying an iPhone and using it only to make phone calls. You're not maximizing its full potential. A digital scanner can change your practice, but you have to unleash it on your practice. It doesn't change your practice by simply being a replacement for goo. And for me and my practice, these are the things that we use our digital scanner for. We use our digital scanner in every room of our practice, from the hygiene room and the new patient experience to wellness scans in the recall experience. And then obviously for restorative and even for appliances, things like night guards and bleaching trays. And obviously at the heart of it all is our clear aligner therapy, our Invisalign, right? Most intraoral scanners on the market serve as a replacement for goo. They have those functions. But many scanners have functions that drive beyond that. Functions that drive more treatment in your practice. What I have found in my practice is the more times that I use my digital scanner in the hygiene room, the more times I get to use my handpiece on those patients. And it's all about helping our patients visualize and see what we see so that they can say yes to treatment. A patient cannot say yes to treatment that they don't see and don't understand. And there is no better way to get a patient to understand complex, comprehensive needs or even simple single tooth quadrant dentistry needs than using your digital scanner. And that's what's become great about these scanners. Obviously, the first scanners on the market were replacements for goo. That's what they did, and that's what they did well. But over the last few years, we've seen additions of other features into these scanners, tools, to give us the ability to do more dentistry in our practice. Caries detection comes on several scanners to help us aid in our radiographs in finding caries. Timelapse or monitoring workflows to help us show patients how their dentition has changed over time between a year visit or 6 months visits. This drives discussions about high-value, comprehensive dentistry with our patients. Doing orthodontic simulations gets more patients interested in orthodontics and Invisalign. And routinely in my practice, patients who get clear aligner therapy have some sort of post-orthodontic restorative that goes into it. A digital scanner isn't simply an impression machine. It's something that drives more restorative dentistry in our practice. It drives communication in our practice. And it helps our patients understand their needs so that we can serve them better. And by proxy, that makes us more productive. For us, it starts here with the digitally driven new patient experience. What does this even mean? This sounds like a bunch of jumbled up buzzwords that you might hear at a lecture. Well, for us, it means that we scan every new patient that walks in the door. Every new patient, every time. And we review that scan with the patient significantly. In fact, probably 90 to 95% of my comprehensive exam happens with the patient on the screen of the scanner, with the patient sitting up next to me as a colleague, with the patient seeing what I see, so the patient can see and understand. And this enables us to reach a new level of co-discovery with our patient. Co-discovery. This isn't us selling dentistry. This isn't us telling our patients what they need. This is our patients learning and discovering with us so that they are a vital part of the treatment planning process. For me in my practice, I do that in 4 simple steps. Feel free to adapt this to any way you want to do it in your practice, but for us, this is typically how it works. We review the color scan with the patient. There are certain things I look at on the color scan. We review the caries detection with the patient. We review the stone scan or the monochrome model with the patient, and then we evaluate the occlusion or look at the occlusogram with the patient. We can see things on the color scan and the caries detection that can help us diagnose more dentistry and help our patient see and understand the needs that they have. On the iTero 5D Plus, it has NIRI technology. NIRI stands for near infrared technology, and that helps aid bite wings at the diagnosis of interproximal decay. It helps me demonstrate and discuss that interproximal decay with my patients. So I see situations like this all the time where I see in that black and white box on the upper right-hand side, I see those 2 white spots in the marginal ridge. But when I look at the bite wing, I don't see very much going on there. In this case, the NIRI tool has helped me diagnose something that I might have missed if I just looked at radiographs. Now, certainly when we look in the mouth, we see maybe there's something going on there, but is there something worth going in and putting a bird of the tooth on? Well, look at this. I mean, obviously once we got into that, we found decay and we were able to restore that decay very easily. In my practice, caries detection software on my digital scanner was responsible for me producing about $15,000 worth of dentistry in 2021 that I would have missed had I not had that software on my scanner. So it is absolutely a valuable part of our everyday diagnosis and treatment planning. Simulating orthodontics, I think, is really important for my practice. 75% of my Invisalign starts come from patients who made no mention on their paperwork about being interested in orthodontics at all or alignment in any way. What got them interested was running a simulation using Outcome Simulator on our iTero 5D Plus. Once a patient saw that, they became interested in Invisalign. And this is Alex. Alex came in as a new patient, and Alex wanted some bleaching and some composite work done to fix those white spot lesions. And I asked Alex, hey, your teeth have moved. Are you interested in moving them back again? And Alex said emphatically, I am not wearing braces. And I said, hey, Alex, that's super cool because we can fix this with clear aligners and Invisalign. And Alex said, you can fix this with Invisalign? And so we ran a simulation and we showed this to Alex. And Alex said, wow, you can do that with Invisalign? I don't have to wear brackets and wires? And I said, Alex, of course we can do that with Invisalign. So Alex paid her deposit that day on the case. We then loaded Alex into our treatment planning software called ClinCheck, and there is our ClinCheck process of the case, and here is Alex's final result. Now we've done obviously a little bleaching, a little composite work, and Alex is thrilled. And we can now take that to the next level with full face simulations. Now we can do orthodontic simulations, but with the full face in mind as well. This is called Invisalign Outcome Simulator Pro, and this allows us to show a patient not just how their teeth will look after orthodontics, but how they will look after orthodontics. And you want to talk about a moving presentation for a patient, this is absolutely it. And this makes case closing easy when a patient can see valuable images like this. We're so adamant about getting scans on our new patients and then wellness scans at least yearly in the hygiene room. And what that does is that opens us the world to tracking patients long term. In the iTero, we use a software called Timelapse, which helps patients visualize how things change in their mouth. And this is most beneficial for patients who have worn teeth. We've never had the ability to track and quantify wear on teeth before, like we can with these features on these new modern intraoral scanners. This helps drive discussion about treatment in my practice every day. And treatment for wear is never low-value dentistry. It's always high-value restorative dentistry that's interdisciplinary in nature and comprehensive. This one feature should interest every restorative dentist in adding this technology to their practice, the ability to track teeth over time and see how they've changed and measure it down to around 5 microns. Well, that's a power we've never had before. And this is something that is a great tool to drive more discussions with your patients. At the end of the day, I think this is a case that puts all of that together. This is Katie. And Katie came to me as a new patient. And when she came in on her paperwork, she wrote down that she came to me for her free insurance cleaning. She had no interest in doing any dentistry at all. She simply wanted whatever she was going to get for free from her insurance company. But using our intraoral scanner at her new patient visit turned her into a comprehensive care patient that generated over $20,000 of treatment for my practice. Talk about a win. Convincing patients who don't think they need any dentistry to get them interested in it, and then to get them to execute that dentistry, is something that we should strive for every day. When Katie saw her teeth on the screen of the intraoral scanner, she noted and she could see how yellow and triangular and thin and fan-shaped they were. And then when she was able to see the view from here, the palatal side of her teeth, to see all of that lingual wear. And we all know where this is from, but this makes that discussion so much easier. And then when we can show it in a stone model, so she can really see, without the color, the surface detail and how much wear is there. This got her asking questions. How do we fix it? Was the question that she asked, unprompted. Well, now it just gets to our classic treatment planning perspectives, right? So we take a look at the occlusion and see where the occlusion is and see that, yeah, she's eroded away all of that enamel on the tongue side of her teeth. And we also don't have any space to fix it because the teeth have had compensatory supereruption. So now we get to put on our treatment planning hats, right? And now we know that we need to either do orthodontics or do crown lengthening or open the occlusal vertical dimension, right? And that's what Seattle Study Club is all about, is giving you the skills to learn that and when to intervene in what way, right? So for Katie, the best way for her was to open her occlusal vertical dimension. So that's what we did. We did posterior overlays on her back teeth in order to give us the vertical dimension that we needed to restore those anterior teeth. So if we take a look here at her occlusion before we did the overlays and her occlusion after we did the overlays, now you can see how much space we have there. In fact, we just used direct chairside composite overlays using an injection molding technique and heated composite in order to get her the result that she wanted, which was to restore her front teeth. So here is her occlusion again after we've done that posterior restoration with the overlays. Now it's time to do what we all want to do, which is prep the front teeth. And so here is our digital scan of our preps. You can see, because we've taken the time to open the vertical dimension, you can see how long and parallel our crown preps are. We aren't dealing with short preparations anymore because we've taken the time to diagnose the patient, diagnose their issue, and then treat the chief etiology, right? Treat the chief problem. And that's what we've done here. And now we're reaping the rewards of it because we have long, parallel, retentive crown preps like we all want to deal with. Here's Katie's provisionals the day of preparation. And here is one of my least favorite photos to take. The full smile with her provisionals in because she's still numb. Her lips are chapped from me prepping all of the teeth, all that. But at the end of the day, all we're doing here is really checking to see where is the incisal edge in the face, right? And as you can see, that harmony between the incisal edge and the lower lip, we planned this case very well, and we got a great pre-op diagnostic setup so that our restorations are right where they need to be within the patient's face. And here's our post-op restorations of Katie's finish restorations, and here's Katie's final smile. And this is a smile that came around because we took the time to use our digital scanner in the new patient visit with Katie to help her see and understand what her issues were. And then once she saw what we see with our eyes, she began to ask the right questions, like, how do we fix this? Had we not used the digital scanner in her new patient visit, she would have come in, she would have gotten her free insurance, Profi, we would have billed her insurance $165, and see you later. But because of that, because of taking the time to use our technology and use it in a way that helps communicate with patients and helps inform patients, we're able to take that patient and turn that patient into a comprehensive interdisciplinary patient. It's what we all dream of. There's no better way to do it than this, the digitally driven new patient experience. Using your scanner in the new patient visit will help unlock a world of new dentistry for you. It will make it to where your restorative chairs are so packed out and so scheduled that you'll need a vacation. You'll need to come to Seattle Study Club Symposium to enjoy some time away for your practice. That's how busy you'll be. This is my monthly production out of my restorative rooms before I started scanning new patients in hygiene. And they're fine. We produced well. Out of the 2 operatories that I have to do restorative dentistry in my small boutique practice, we did pretty well. But when you look at it after we started scanning our new patients and our recall patients with our digital scanner, it's an increase of 26%. We didn't get a coach. We didn't hire a consultant. All we did was start scanning our new patients and our recall patients with our digital scanner and using that technology to help inform our patients so they can make the right decisions for them and that we can treat them the way that we want to treat our patients. Some of you are thinking, I don't have a practice that can tolerate. I have an old practice, whatever it may be. And this is the operatory that my dad practiced dentistry out of for 25 years in Amarillo, Texas. Doesn't get more 70s than this photo. Couldn't be more 70s. If the Bee Gees were playing a concert in the corner of this operatory, just Barry Gibb back there singing, "How Deep Is Your Love," could not get more 70s. Jimmy Carter himself could be the patient in the dental chair, and this room could not get any more 70s. But if you take a digital scanner and use it and put it in this room, even this practice can become a digital, modern practice. That is all it takes. Any of you can reach out to me anytime at the email address you see here or anywhere on social media at Joshua Austin DDS. Thank you guys so much and have a great day.